So now I'd like to actually introduce our next speaker, Dr. Rachel Gicquelais, and she is a substance use, and infectious disease epidemiologist. Her research focuses on harm reduction and the prevention of overdose, HIV, and hepatitis C. She has a PhD and an MPH in epidemiology from the University of Michigan, and we won't hold that against her. Although I do note she's wearing blue. Just saying. And she completed her postdoctoral fellowship in HIV epidemiology at the Johns Hopkins Bloomberg School of Public Health before joining our faculty here at the University of Wisconsin, Madison School of Nursing. I had the great opportunity to hear her speak at the last Board of Visitors meeting. She was one of our speakers, and I just knew that this would fit in very, very well with our thoughts on public health. I think it's also important to note that, truthfully, I do not remember anybody on the faculty back when we were there, 68 to 72, that was not a nurse. So, and I think that's been a very great addition to the School of Nursing, bringing in some other important professionals, because the interprofessional work is so incredibly important. So with that, Dr. Gicquelais is going to be giving her talk on the United States overdose crisis, public health response, and ongoing challenges.
Well, thank you for that lovely introduction and for being with me at the Board of Visitors talk and inviting me back. That I'm so delighted to hear that you enjoyed my talk then, and hopefully this one won't disappoint. And yeah, I am just really thankful for the introduction and to be with you all in this really, critical moment of celebrating your careers and your success. And as you introduced me, I am an epidemiologist and not a nurse, but my past 2 years working in the school have really, I think, solidified some early interactions in my own career where I was working alongside public health nurses in public health practice. I actually worked at the Arkansas Department of Health for a couple of years. And so I am delighted to now say that my team of students is like half MPH students and half nursing students. And I really love to see them interact and work on what I think is a pretty complex public health problem that I'm going to tell you about. So let me share my slides. Okay. Hopefully those are coming through, and I'll do slideshow. The good, Jordan, I can see you on video.
Yep, looks great, Rachel.
Awesome. Okay. Great. So kind of fitting in within my research interests, I am going to tell you all a little bit about the overdose crisis, a review of ongoing challenges and just kind of the epidemiology of the overdose crisis. And I'll touch on a little bit of my work as well. And I really appreciated that this talk came with a lot of flexibility because it really offered me just kind of a minute to pause and reflect on kind of the bigger trends and why I'm doing the work that I'm doing. So I'm excited to hear your questions and get your feedback at the end. So I'll try to cover a couple of different areas in my 15 minutes. One is just to kind of tell you about the overdose crisis. How did we get here to where we are over the last 20 years? And what are some particularly pertinent challenges that are going on today? And then I'm going to try to end kind of similar to Susan with a note of hope and talk just a brief bit about some of my own work and some of the other opportunities that I see to kind of improve our current situation. So just kind of getting us started with some grounding in data. I'm an epidemiologist, so that's always where my head goes first. This is a graph where I'm just showing you simply the number of overdose deaths that we've had over time in Wisconsin from 2000 to 2021. And you're looking at all drug overdose deaths in the black line and in red opioid overdose deaths. So like you've probably seen in news articles and in other sources, Wisconsin has not been immune to the rise in overdose mortality over the last 2 decades and now even more. Most deaths are caused by opioids in this state, like other states in the US. And a particularly concerning more recent trend has really been this rise that started in 2020 towards the beginning of the pandemic, where in 2019 people were kind of like, are we leveling off? Maybe we're doing some things right, and then COVID hit. And of course, I think that had ramifications for everyone working in health, in research, and in other fields. And that was certainly true for overdose mortality. So we saw nearly a 30% jump in deaths in 2020, and that trend unfortunately continued in the 2021 data. Could be due to lots of reasons, things like, your treatment access is interrupted, economic instability, all of the things that we know impact the social determinants of health. And unfortunately, we're seeing the trends continue. So I think this graph is a little bit older now, but just to, again, kind of further explore some of these trends, the CDC, in their exploration of what drugs have been causing this rise in deaths, have really kind of carved out 3 different waves of the overdose crisis. So we're not exactly dealing with one, general rise in overdose deaths. It's really explained by some changing behaviors in drug use over time. So around 1999, you may remember that pain started to be seen as a vital sign, and there was this huge increase in prescribing opioids to treat acute and chronic pain because still unaddressed today, we have a pain epidemic alongside of what is now an overdose epidemic. And so this light blue line is kind of starting to show a trend in rising deaths due to prescription opioid misuse and overdose. As this started to be recognized, some of the regulations around opioid prescribing became stricter, and we started to have some community-based efforts to monitor people's opioid prescribing and opioid use, especially with prescription drugs. And so some of that has leveled off due to policy efforts, but unfortunately in 2010, through some kind of unintended consequences as well, just maybe changing norms around drug use, we started to see a leveling off in the prescription opioid deaths and a rise in heroin-related deaths, which heroin is, of course, just a different type of opioid, but gives kind of similar effects. But since it's bought illegally, it's highly susceptible to things like a contaminated drug supply, which shortly followed after in wave 3, where our heroin supply in the US started to be contaminated with illicitly manufactured fentanyl, which fentanyl is an opioid that's 50 to 100 times more potent than heroin. So much more easy to overdose on in a smaller dose. And it's also much cheaper to manufacture than heroin. So it's very commonly now cut into the heroin supply. And we kind of don't have heroin in the US anymore. It's mostly fentanyl, at least mixed in with another drug. And so over this last kind of 20-year period, we've seen a lot of different changes in the drug supply that have really made it tough to kind of stay on top of this epidemic. And I put up these numbers to kind of put into perspective in relation to another historical epidemic that we've seen. But currently with 2021 data, we're looking at almost 300 people dying per day of an overdose, which is an enormous number. And most of those are due to opioids. And in comparison to another epidemic you may remember or have worked through in your careers, and is certainly a topic that I also work on, in the peak year of AIDS mortality, 1995, when we were still getting HIV medications dispersed to people and treatment wasn't as universal. So it was the peak year of AIDS mortality, 138 Americans died per day of AIDS. So the difference here is just huge. And I remember back in my career when these numbers crossed, when we hit, 138 per day for the first time, it was not that long ago from overdoses. And it has been honestly just really devastating and scary how quickly things have grown from there. So that's not to take away of the importance of the AIDS and HIV epidemics. I do some work in that area too. And I think, they changed public health forever. They changed practice forever. But at the same time, looking at these numbers in relation to each other always really kind of makes me just think about how terrible the situation we are in now, and what can we do to reverse course. So before I get there, I'm just going to talk for a couple of minutes about some of the most pressing issues like this year, as we look into 2022 and based on some of the most recently available 2021 data. So I had just introduced that there have been 3 waves of the overdose crisis. And as people have been examining the data, we're really now kind of recognizing, like, I think we're actually in the 4th wave. And this 4th wave is really characterized by fentanyl contamination, not just of the heroin supply and other opioids, but really of the entire drug supply. Like I said earlier, illicitly manufactured fentanyl is cheap, so it can be a cutting agent in other drugs as well. So we're really seeing it to start showing up in the stimulant supply, so cocaine, methamphetamine. And that's especially dangerous because a lot of times when people take a stimulant, they're looking for an up, not a down. They are not expecting it to take an opioid at all. And so it can be a particularly dangerous drug to cut an opioid into. So just kind of looking at the data a bit more here, this is data from 2015 forward on overdoses in Wisconsin. And again, right about that 2020 mark, you're seeing the gray line and the pink line start to go up, and those are cocaine and methamphetamine deaths. A lot of those also involve fentanyl. It's just not quite articulated here, but as you can see, fentanyl related deaths have gone up too. And a lot of times, again, these are in combination. So certainly some really concerning trends with that. And then I think the other critical issue, which has deserved more attention for years, but is increasingly getting attention now, thank goodness, is inequity. So you may recall, several years ago in early conversations about the opioid crisis, we were talking a lot about rural America, which mostly impacted white America. There's a really famous book that, for example, is about people who were using prescription opioids in West Virginia, and very rural West Virginia. And I think that became kind of the picture of the opioid crisis. But recently, and this actually dates back to 2018, it started to be recognized that, we're starting to miss a growth in overdose mortality among racial and ethnic minorities, and particularly the Black community. So this paper from 2018 that I have a table up here found that in a handful of states, as early as data from 2015, overdose death rates among Black individuals in Wisconsin and other states, but not many, exceeded the rate of overdose mortality among white individuals. And that's what you're seeing in the red here. And this was, unfortunately, not well publicized until maybe the last year or two. And that's not to say that more Black individuals die than white individuals, it's the rate. So the number of people in that racial ethnic group per population that is really concerning and really represents a growing inequity. So as people have started to look into this, they've sort of looked nationwide at what's the change in overdose mortality involving stimulants, especially. So coming back to this idea of our drug supply just keeps changing, and stimulants, some of them, especially cocaine, are more common in urban areas, as are the Black community in Milwaukee is larger than we see in rural Wisconsin. So these two kind of issues are starting to converge and really create some concerning trends. And all that I'm showing here in these maps is rates of stimulant, opioid mortality, cocaine and opioids on the top, and methamphetamine and opioids on the bottom, where you're seeing on the left the graph in 2007 related to that mortality, and on the right in 2019. And this is only among Black individuals. And you can see, basically the takeaway is the right-hand side maps light up red, because we're just seeing this growth in overdose mortality everywhere in Black communities. I think this paper estimated about a 575% increase over this 12-year time span. So I'm encouraged that we're having more discussion about this, and people are thinking about not just working in rural areas or suburban areas, but there's definitely a lot of work to be done. Okay, let's turn to some reasons for hope. I'll just highlight a few. One of them is kind of thinking about lessons learned from COVID. So this paper came out very recently, just at the end of August. And this study did a really nice job of looking at how the transition to telehealth-based treatment for opioid use disorder, specifically for people who were on medications like methadone or buprenorphine, how that benefited them during this period of COVID, and what does that mean for, how we want to carry telehealth forward. Typically, medications like buprenorphine or methadone are highly restricted. Someone might have to go to a clinic every day to get a dose, but a lot of flexibility was allowed for in COVID for the first time. And essentially the takeaway, without reading this to you, is that those kind of telehealth adaptations really improved retention and treatment, because we removed some of that kind of patient burden of having to go to a clinic every day when maybe they're experiencing transportation or other barriers. And that ultimately lowered their odds of overdosing, which really lends support for permanently kind of offering this telehealth model, because clearly it's doing good things for patients. Another piece of kind of encouraging news is that this blog post came out. If you read none of the papers in my talk, this is the one I would say is the most critical. So the director of the National Institute on Drug Abuse puts out a blog every so often, and she acknowledged in her most recent one, 5 areas where more research is not needed to curb the overdose crisis. I would say especially numbers 1 to 4 here are kind of controversial in communities, and getting communities on board to establish a syringe service program is something that is still difficult and a little bit controversial. But having someone like Dr. Volkov, who heads, a huge NIH center, kind of acknowledge that this is an effective intervention is huge for destigmatizing and kind of encouraging people to move from, we don't need more research on efficacy or effectiveness. We need more implementation. We need to get these effective interventions out here. And so just to kind of, before I wrap up, I'm going to tell you really quick about 2 studies. And if we want to talk more about them in the discussion, we can. But my work really centers around 2 of these areas. One is to help with more distribution of naloxone, which is an overdose reversal medication. And then I also do a lot of my work with our syringe service programs in Wisconsin. And so just really quick, I actually talked about this study at the Board of Visitors meeting. It is a study that I did with Gina Bryan, who's a clinical faculty member, and a number of nursing students who are now out and practicing and doing great things. And we really wanted to examine, how do we help substance use treatment organizations start to provide overdose education around naloxone. So people are in treatment, and that's not typically a place where you do harm reduction as well and provide an overdose reversal medication for them to take home just in case. But actually it is a recommended practice that they receive those services. So our study was looking at, how do we support that implementation? And I'll skip the slides just in the interest of time. But we got great feedback, and the treatment organization that we paired with actually started doing this. And I'm happy to talk about it more in the discussion, just don't want to go over time too much. And our patient participants were really supportive as well. And then just the other thing I'll quickly highlight is as I said, the other part of my work is really looking at, syringe service programs are highly effective in delivering information, education, needed supplies to help keep people alive while they are kind of navigating their drug use, how that's going to play out for their life. And so I feel very lucky to partner with Vivint Health on a number of research projects. They run 10 syringe service programs in Wisconsin, and just wanted to highlight one study here where we're really trying to explore, how could technology actually help improve the reach of those wonderful services that they already provide? So we're doing a small pilot trial on that will hopefully expand. And I think I will stop there just in the interest of time.